I'm Michelle Jones with the City of Brownsville Public Health Department, Maternal and Child Health Division. And today I'm here with Rosary Muñoz from the Valley Regional Medical Center, and we're going to talk a little bit about mental health, in particular that postpartum stage after delivery. So, Miss Rosary, would you like to tell us a little bit about yourself?
Yes, thank you. My name is Rosary Muñoz, and I work at Valley Regional Medical Center, and I also practice as a psychiatric mental health nurse practitioner. So we're going to talk about postpartum depression?
Correct.
Okay.
Yes.
So usually with postpartum depression, there's other names for it also, like the perinatal depression or the peripartum depression, but usually it occurs about 1 month after pregnancy, because there's some that have depression but it'll go away within 2 weeks. So for it to be diagnosed as postpartum, it's usually about 1 month. And then also it depends on the symptoms that they have. So some of the symptoms include like the exhaustion, like they have no energy, they're feeling guilty, or they're always crying, they're not able to sleep, the appetite is decreased, feeling of guilt, and like for some they're not even able to take a bath, you know, they're not able to function physically. And then also the thinking where they might actually hurt the baby. So that's some of the symptoms that we look for, and if they have 3 or 4 of those symptoms, then yes, they're usually diagnosed with postpartum depression.
Okay, good. So since we know that this occurs a month after the delivery of the baby, what are we seeing locally with our women when it comes to postpartum depression?
So like here in Texas, there's about 14.7% of women that actually have been diagnosed with the postpartum depression.
Okay.
So it affects about 1 out of 7 women.
All right. Now, one thing that we always talk about is breastfeeding, especially like the after, when they start engaging in breastfeeding. Now, some reports say that it's good and it actually helps alleviate some of those symptoms. So do you want to tell us a little bit about that?
So every woman is different. So it's not going to be the same for everybody. So like some of the research that I actually did showed that some studies actually stated that breastfeeding actually increases depression in mothers. Okay, and then there was one that said that women who actually just gave formula also developed depression because of the lack of the bonding, right? And then there was another one that says that usually women that do have the postpartum depression, they tend to stop breastfeeding earlier.
Okay.
Yeah.
All right.
So it does impact.
Okay, so one thing that you were talking about is that they do end up quitting breastfeeding earlier if they do have postpartum depression. Is that due to any one particular cause, or is it just the general state of having depression?
It's usually related to the state of the depression, and because of the fact that they're not being treated. You know, and so for some moms, once they're diagnosed, then yes, they're going to need antidepressants to help them, or they might not need antidepressants, they might actually just need counseling. Okay. You know, and seeking the professional help that they need.
Okay. And let's say that they do receive medication. Does that impact the ability to breastfeed? Because we're talking about introducing a possible medication through the breast milk.
Yeah, through the breast milk. So there's 2 antidepressants and then 2 TCAs. So they recommend Paxil and sertraline for antidepressant use during breastfeeding, because of the fact that the levels are not high in the baby.
Okay.
And when the baby drinks it. And then of course with the TCAs, it's the nortriptyline or the imipramine. So those are usually the medications of choice.
All right.
So also like with breastfeeding, you know, it can, with the women that are postpartum depression, there's some pros and cons to it because of the fact, you know, with the pros is the bonding. You know, they have that bonding, the baby being latched on, and for some women, you know, that actually helps them overcome the depression because they're so close to the baby. But then the other cons, because then they do stop breastfeeding early, or they don't want to breastfeed at all because of the depression, then you worry about the failure to thrive, any kind of delayed development of the baby, you know, sleeping difficulties, and then later on learning problems or emotional problems.
So I know that we have mentioned that a lot of women don't seek treatment. What are we suggesting? Let's say if we are having some of those symptoms that you described earlier in the segment, how would I go about seeking treatment, or who would I go to talk to about this?
So I believe part of the screenings that they've been starting to do are actually the depression screenings.
Mm-hmm.
So if they do, come out positive, or depending how they are on the scale, then the doctor should be referring to a specialist.
Okay.
If it's not a psychiatrist, maybe just a counselor, the nutritionist also, they can help.
So locally, are there any resources available for these women other than going to their primary care physician or their OBGYN?
Well, that are free of service? I don't think so. But maybe to look it up. Counseling, at least counselors, because just to talk about it, and then the counselors can actually recommend, okay, maybe some medication would be helpful.
Okay.
And then they can look for the psychiatrist, or if the doctor will provide the medication.
Oftentimes we're on Medicaid, or we have private insurance when we do deliver a baby, and we have the 6 weeks after, which most insurances are covering. Does insurance cover any of the mental health aspects of that, or at least for the initial diagnosis?
So I was looking up some information, and it did mention Medicaid was the one that actually would cover for mental health issues.
Okay.
So again, it's up to the doctor to do the screening tool, because that's the only way that you can diagnose.
Okay. And then I'm assuming for the other insurance companies, it's probably up to whichever plan that you have? Okay. So one thing that we can recommend to women that are experiencing some of the symptoms that you discussed is when they are going in for that 6-week follow-up checkup.
To let the doctor
Yeah.
know. To let the doctor know, and then again, because they can redo the screening tool, because maybe they weren't depressed, earlier, and then now they are, since now the baby's at home, things are different, the environment's different. So yeah, they can redo the screening tool again.
All right. So that was some really great information that you've shared with us today. And we'd like to thank Rosary Muñoz from Valley Regional Medical Center for coming down and sharing that important information with us. We also want to thank the Breastfeeding for a Healthy Brownsville Coalition for helping put this together. And Rosary, is there any last recommendations we can give our female viewers, and even male viewers, if their wives might be experiencing any of this, or their partners, if they are having those symptoms?
So yeah, if you are having symptoms, if you can go ahead and follow up with your provider, your obstetricianist, and let them know, so they can go ahead and refer you out to the specialized doctor that can help you.
All right.
Thank you.
Thank you so much. You guys have a great day.